How to do a breast self-exam. Breast self-exams are an optional screening tool for women to check themselves for early signs of breast cancer. Performing these exams monthly can help you familiarize yourself with the look and feel of your breasts so that you can more easily detect changes. 1. Though breast self-exams were once thought to be essential to screening for breast cancer, they are now considered a helpful, optional tool. Understanding breast exams. Learn why to do them. Some women like to perform regular breast self-exams. Regular examinations allow you to detect changes that you may not have otherwise noticed, which can help you detect any cancer. However, self-exams should never take the place of mammograms, since these are considered a more accurate test. When you do an exam, you are looking for pre-cancerous lesions or early signs of cancer before it has spread. At this stage, you can treat it before it grows to be life-threatening, which lowers your risk of death from breast cancer. In addition to self-exams, professional screening involved a mammogram, which is a kind of X-ray specifically used on breasts that can show masses, calcifications, or other signs of cancer. 2. No study has proven that breast self-exams decrease the risk of breast cancer death, which is why many experts do not recommend them. Because of this, many women choose not to do them, but they can still be helpful. 3. 4. Know if you are at risk. There are groups of individuals who are more at risk for breast cancer. There are genetic reasons and events in your medical history that can put you more at risk. These include a mutation in a breast cancer gene called BRCA, previous history of breast cancer, a family history of breast cancer, especially at a younger age, women who had radiation of the chest between 10 and 30 years of age. Start at the right time. Breast self-exams should begin as early as age 20. You should check your breasts once a month so you can note changes over time. You can continue yearly mammograms starting at 55, or you can go down to once every 2 years. 7. If you are a higher risk of breast cancer, you may begin screening at age 40. Your doctor may order you to get tested more frequently if you are more at risk of developing breast cancer. Have a clinical breast exam (CBE). In addition to your monthly self-exams, your doctor should perform a breast exam at least once a year during your annual physical or gynecological checkup. Your doctor will first perform a visual inspection of both your breast and nipples. They will then do a physical examination of them similar to your self-exam, feeling all the breast tissue and the tissue under both of your arms. They look for any puckering or changes of the skin around the breast, abnormal discharge or orientation of the nipple, or any lumps, which could signal underlying cancers. 8. Get special testing. Sometimes, a self-exam will not be enough. If you are especially high risk, such as an increased and long family history of the disease, your doctor may recommend a breast MRI. MRIs are more sensitive tests and show more detailed scans. However, they often lead to more false positives, which can lead to unneeded biopsies. Understand that the issue of breast self-examination is a subject of debate. In the past, a monthly breast self-examination (BSE) was recommended for all women. However, in 2009 the U.S. Preventative Services Task Force recommended against teaching women to do consistent and formal self-examinations after several large research studies concluded that BSE didn't reduce mortality or increase the number of cancers found. At present, the American Cancer Society and the U.S. Preventative Services Task Force recommend that BSE should be done at your own discretion. These organizations also emphasize that the real key is to be aware of what is normal for your own breast tissue. Part of the pushback against BSE is because it can lead to unnecessary testing, such as a biopsy, which can cause harm to the patient as well as a financial burden on the healthcare system. The problem is that BSE may draw attention to benign lesions, whereas mammograms can identify those malignant lesions that are real cause for concern and medical treatment. 10. Be aware as well that a BSE should never be done in lieu of a physician's clinical examination or mammogram. At best, doing a BSE can help you become more aware of what is normal in your breasts and can help you assist your doctor in detecting changes. 11. Know what to look for. There are a number of signs that you should be aware of when visually or manually checking your breasts for cancer, including the following. Changes in breast size or shape. Swelling from a tumor or infection can change the shape and size of the breast tissue. This often occurs only on one breast but in some cases can occur on both. 12. Your breasts may also change size during certain times in your menstrual cycle, so having an idea of what is normal for you at any particular time of the month is helpful. Discharge from the nipple. If you're not breastfeeding, there should be no discharge coming from the nipple. If there is discharge, especially without squeezing the nipple or breast tissue, talk to your physician. 13. Swelling. There are aggressive and invasive types of breast cancer that may cause swelling in breast, collarbone or armpit. In some cases, the swelling occurs before you can feel a lump. 14. Dimpling – tumors or growths in the breast near the surface of the skin or nipple can cause a change in shape and look of the tissue, including dimpling or puckering of the skin like the skin of an orange, also known as peau d'orange. Look as well for a newly inverted nipple, which is also a sign of a problem. 15. Some women have naturally inverted nipples, which are not a cause for concern. A change from your normal state is redness, warmth or itching. Inflammatory breast cancer is a rare but aggressive type of cancer that presents with symptoms similar to an infection in the breast, a warming sensation, itching or redness. 16. Do a visual BSE. You can do this whenever you like, although it's a good idea to do it after your period, when your breasts are less tender and swollen. Try to do it every month at around the same time. You can even mark down when you do the exam each month in your planner or journal to keep track of it. In front of a mirror, sit or stand without a shirt or bra on. Lift and lower your arms. Look for any changes to the size, shape, tenderness, and appearance of your breast tissue, using the above signs as your guide. Then place your palms on your hips and flex your chest muscles. Look for any dimples, puckers or other abnormalities. Do a manual BSE. Devote a set time each month to do a manual BSE. If you are still menstruating, the best time to do this is a few days after your period when your breasts are the least tender. Lie flat and place your right hand behind your head. Using the first 3 fingers of your left hand, feel the breast tissue on your right breast. Be sure to use the pads of the fingers, not just the very tips. Feel for anything that feels hard and round. 21. Start at your armpit area and work your way towards the center of each breast. Move across to the middle of your body until you only feel the sternum breastbone. 22. Use 3 different levels of pressure to feel the tissue: light pressure at the top for tissue just under the skin, medium pressure to check tissue in the middle of the breast, and deeper pressure to feel the tissue closest to the chest wall. 23. Make sure to apply each pressure level to each area before moving on. 24. Once you've done one breast, do the other. Put your left hand under your head and perform the same exam on your left breast. Squeeze each nipple gently to check for discharge. 25. Remember that your breast tissue extends to the area near your armpit. This area can also develop lumps or cancer, so it's important to check there is there during your manual BSE. 26.